Hi, Dr. Shu here from Line Plastic Surgery in Los Angeles. Today we're going to talk a little bit about changing the shape of the head or skull reshaping through different implants and skull augmentation. So it's interesting that we found that a lot of patients were searching for skull reshaping, which sounds crazy. It sounds like you're going to do something invasive and change the skull and the bone itself. Actually, what we do with skull reshaping is really changing the appearance of the skull. So it's sort of reshaping the skull appearance through the use of implants. And so it's different from what it sounds like, but essentially that's the goal, and that's what we're trying to achieve. So today I'll talk a little bit about the different methods that we use, mostly implant-based, to change the appearance of the skull or the head. So the common requests that we get here at Line are, number one, the most common is to improve the shape of the forehead, actually. And that's for a couple reasons. Some patients are older, and actually when they get older, we do lose some volume in the face, including in the upper part of the face. So the forehead will actually look more sunken in from the side view. So some patients will want a little bit more volume to kind of restore a little bit more of the youthful contour of the forehead. Some patients are just younger and they want to just have a nicer, more aesthetic looking forehead, and that's just a purely cosmetic thing. In addition, we get also a lot of requests for the back of the head, surprisingly. And the common things that I hear are patients who say that ever since I was a kid, I was put back on the back to sleep for my parents for baby safety. And over time, I developed a really flat area in the back of the head, and so I've always had to kind of change my hairstyle to kind of cover the flatness of the back of the head. And it's surprising that you think it would bother people, but actually it does. And so we do have a common number of people who come in wanting to have some augmentation in the back, just to round it out a little bit and to have kind of a more natural shape in the back, so that their hairstyles don't need to be so poofed out in the back to achieve a nice contour. And then occasionally we have some patients who want some augmentation on the top just because the top is very flat. And you see this not so commonly, but you do see it in some patients. Some patients will come in with that request. I'll feel it and say, oh, actually, yeah, it is a little bit flat up there. And maybe, if they want, they can kind of make it a little bit rounder. So here at Line, what we do is we achieve that through different implants. The implant of choice for me is methyl methacrylate, or we just abbreviate and call it MMA. MMA, or methyl methacrylate, is an implant material that's been used actually for decades. It's been used here in the United States and all over the world, mostly as a bone substitute. It's sort of the material that a lot of orthopedic surgeons will use when they're doing knee replacements, hip replacements, shoulder replacements, any kind of replacement that requires like a bone substitute that is formed, essentially acts like glue that keeps the implant in place and keeps the implant together with your bones. So the good thing is that the safety profile is very well elucidated. We have a lot of experience with it. We know the body tolerates it really well, and we know that people don't really have long-term problems with it. So for me, those are all very good selling points for using that as an implant. And so I prefer using MMA compared to any other type of implant, such as in the head. Silicone implants, they can be used, but they've sort of fallen out of favor because people can feel the edges a lot. For me, MMA is a very smooth transition. It can be molded very much to the patient's shape, and it's a very individualized, customized implant. So that works pretty well because people's heads are very different shapes to begin with. The surgical procedure itself essentially entails, let's say for the forehead, small incision behind the hairline so it's nicely hidden, and then I'll basically do a careful dissection of the tissue, the skin and the fat, and also up off the bone. And then we put basically some MMA material into the area and just carefully mold it to be very, very smooth. And that's where a lot of the care comes in, is sort of molding it to make it kind of nice and round, and so it doesn't have a lot of bumps, doesn't have any sharp edges, nothing that's really visible and really palpable or something that the patients can feel. And once it's nicely smoothed, we'll wash it with some cold irrigation, essentially to make it set in place, and then we basically close up the skin. So it's a pretty quick procedure. Probably takes about an hour, hour and a half. Doesn't require general anesthesia. Patients are pretty comfortable through the procedure. For things like the back of the head augmentation, occiput augmentation, or the vertex augmentation, same idea. We make a small incision sort of in the hairline, make dissection over the area and lift up the skin and the muscle and the fat off the bone, and then place the MMA material so that we can mold it carefully in place and then kind of customize it to the patient's original head shape. But same general principles. It's an implant. We kind of mold it carefully, irrigate it with some cold saline so it kind of sets in place, and then we just close it up. So with regard to post-op recovery, as mentioned before, you'll have a little wrap and you'll have some swelling for the first few weeks. We have a couple of tricks to kind of minimize that swelling, but it takes a little bit of time. Patients do need to allow probably 2 weeks for that swelling to really go up and down, enough so that they feel comfortable meeting their friends and going back to work. After the wrap comes off, patients will be transitioned to a Velcro strap, something to kind of give a little bit of compression in those first few weeks when it wants to swell. And then once the healing is done, essentially the nice thing is the implant kind of stays there. It's not something that's expected to go away over time. It should be able to keep longevity, and we expect that it can stay long term. And patients can expect to have a nice result with regard to improved forehead contour or a little bit more volume in the back, or occasionally the patients who want a little bit more augmentation and rounder on the top. And that pretty much covers it. So you can see it's really reshaping the appearance of the skull, and we're really doing it through the use of implants.